Most people that we see, and I would venture a guess that most of the general dentists that deal with patients that are edentulous and have complete upper and lower dentures, you know, they're doing the best they can with what they have. And over the past 20 years, I've seen a major change in what we can provide for implant-supported dentures, either in the upper jaw or lower jaw, especially the lower jaw. Because when you wear a lower denture, most of the time, it's hard to get that lower denture to fit adequately without the use of multiple applications of denture adhesive. An implant-supported denture is where we place endosseous implants in either the upper jaw or the lower jaw that then integrate or fuse to the bone, and then once that has happened, the denture is then snapped into place and doesn't move at all. So it's supported by the implants, which allows people to change their diet, allows people to snap it into place, and basically go about functioning as a normal person without worried about the embarrassment of their teeth not fitting or falling out in a really inopportune time. Once you place implants into the bone then ceases to resorb. So not only does it enable you to wear your denture, but it also stops your bone from resorbing those specific areas, which is key to be able to maintain those and even place them again in the future if needed. So you'd come to our office for an evaluation, a consultation. We'd sit down, look at a panoramic x-ray, which is sometimes sufficient. If there's any question of whether you have enough bone, in each one of our office we have a CT scanner that we can look at your bone in 3 dimensions, determine the quality of your bone, the density of your bone, and then decide whether we feel that you're going to be a good implant candidate.
Once we've determined?
Once we've determined that you're a good implant candidate, then we will set up a procedure, well, you'll come in, we will plan it out either with the lab to make a surgical stent so that when I place the implants in the proper position, the dentist and I then communicate, well, you know, this is a good treatment plan, this is where it is, this is where they go. So then when I'm finished with the surgical procedure and they go back to the general dentist office for restoration, there's no surprises.
Let's close this thought with relating, let's bring it back full circle and relate back to the people. I know you kind of said one, but let's just have one extra to have it. Let's relate back to the people in that they can move forward with confidence. You can eat what you want.
Yes.
You could even say steak and apples and nuts and
Yeah.
things that people haven't eaten for decades.
Right.
Maybe.
Well, I think most of the patients that I have done implant-supported dentures for consider it life-changing. They don't have to use adhesive anymore. They can put their teeth in and eat whatever they would like, whether it be a nice juicy steak or I can bite into an apple and not have to worry. I don't have to cut up in 5 pieces. I can just bite it and chew it like normal, which allows them to integrate back into society and not feel self-conscious about it.
Great job.
That was good, Rick. Right?
Yep.
Especially the little old ladies, man, they love it.
Yeah.
They snap into place and they're tickled pink.
Yeah. That's
Yeah.
funny.
So I've seen major changes in people's ability to communicate, confidence with a implant-supported lower denture because they're not worried that it's going to fall out when they're at a dinner party. It's going to fall out when you're playing golf with your buddies. It snaps into place and stays. It can be life-changing for some people.